Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loibol, and this week we're talking about cholesterol and heart disease. Is the deadliest condition preventable? Understanding ASCVD and LDL-C. Imagine if the deadliest condition on Earth was preventable. Atherosclerotic cardiovascular disease, or ASCVD, is the underlying condition that causes heart attack and stroke, which are the first and third most common cause of death worldwide. The word atherosclerosis comes from the Greek words athero, meaning gruel, referring to the porridge-like plaques found in diseased blood vessels, and sclerosis, meaning hardening. Atherosclerotic cardiovascular disease is a hardening of the system that includes the cardio-heart and vascular blood vessels caused by fatty plaques. ASCVD takes a long time to develop, and the effects can last a lifetime. Complications include heart attack, stroke, coronary artery disease, peripheral artery disease, and heart disease. There are many risk factors associated with ASCVD, including LDL cholesterol, or LDL-C, levels above normal, hypertension, diabetes and insulin resistance, smoking, high triglycerides, inflammation, a sedentary lifestyle, and obesity. Of these risks, however, high LDL-C has by far the most evidence showing that it causes ASCVD. A 2017 meta-analysis of 2 million people enrolled in high-quality studies found compelling evidence of LDL-C's impact on atherosclerotic cardiovascular disease. The evidence is so overwhelming that some researchers claim LDL-C is the only causal risk factor. What is LDL cholesterol and how does it cause porridge-like plaques in the cardiovascular system? LDL-C stands for low-density lipoprotein cholesterol and is a complex particle made of fatty lipids, lipo, and proteins that transports lipids around the body. It usually travels in the bloodstream and can enter cells that need extra lipid energy through highly controlled cell receptors. When LDL-C levels in the bloodstream are high, however, the system breaks down. The cells that form the borders of veins and arteries, called epithelial cells, can't keep the border shut, and LDL-C can enter the spaces behind them. LDL-C particles then get trapped and can be oxidized, making them dangerous. Oxidized LDL-C particles release inflammatory signals, which cause an inflammatory immune response. The immune system can't properly get rid of the LDL-C particles and instead make the situation worse. Eventually, a hard plaque made of LDL-C, immune cells, muscle cells, and other detritus is formed, releasing inflammatory signals and blocking blood flow. In the worst cases, this hard plaque breaks off and blocks blood vessels, leading to important organs like the heart and brain. How can such devastating consequences be preventable? The best way to treat ASCVD is to prevent it in the first place. Non-pharmaceutical preventative methods encourage a healthy lifestyle. Eat healthy foods like fruits, vegetables, whole grains, and nuts. Avoid eating unhealthy foods like trans fat, red meat, excess sugars, and sweetened beverages. Exercise. 2.5 hours a week of moderate intensity exercise or half as much vigorous activity. And smoking cessation. Clearly, this is much easier said than done, as evidenced by, once again, ASCVD being the leading cause of morbidity and mortality worldwide. Standard pharmaceutical treatments target LDL-C in a few clever ways. Statins are the standard of care and lower the amount of LDL-C made by the liver. PCSK9 inhibitors increase the amount of LDL-C taken out of the bloodstream. And bile acid sequestrants, ezetimibe, and bypass surgery reduce cholesterol absorption. Patients with high LDL-C levels should talk to their doctor to find the best treatments to get LDL-C to target levels. Unfortunately, even with the high effectiveness of medication and a high risk of developing ASCVD caused by unmanaged LDL-C, the majority of patients are still receiving inadequate treatment. Clinical trials continue to seek new treatments to help lower the risks and complications due to ASCVD. If treatments with better adherence are found, we may be able to finally prevent the deadliest condition on Earth. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.